Things like heart disease, diabetes, cancer. We tend to think of them as, well, personal health problems, right? But what if they're actually all part of this huge, silent epidemic that's sweeping the globe? And, get this, what if the solution is hiding in plain sight? So that's really the big question we're going to dig into today. I mean, what if we could actually prevent more than half of the world's deadliest diseases for just a tiny, tiny fraction of what we're already spending on healthcare? I know, it sounds almost too good to be true, right? But the data says it's not only possible, it's this massive opportunity that we absolutely cannot afford to just let slip by. Okay, and right here, this is the core of it all. It's really a tale of two paths. On one side, you've got these non-communicable diseases, or NCDs for short, and treating them, we're talking about high, often lifelong expenses that are just crushing entire economies. But then you look at the other side, and what do you see? Prevention. It's a low, sustainable investment that doesn't just save lives, it can literally fuel a country's growth. All right, so first things first, let's really wrap our heads around just how big this problem actually is. You know, there's this really common myth that NCDs are just diseases of wealth, something that only affects rich, older people. But that's just not true. The reality is, something like 80% of the disabilities from these diseases happen to people before they even hit 60. And they hit developing nations the hardest. It turns out poverty itself is one of the biggest drivers. And this slide, wow, this really drives the point home. It's from a study in Glasgow, Scotland, and it compares risk behaviors in lower-income neighborhoods versus higher-income ones. Just look at the difference. In poorer areas, 79% of people weren't physically active, compared to 61% in wealthier areas. And for smoking, 39% versus 24%. That's a huge gap. It really shows you that poverty isn't just about money. It dramatically limits your ability to make healthy choices. Okay, so the human cost is massive. But what about the money? Well, the economic impact, it's absolutely staggering. $84 billion. Just let that sink in for a second. That's how much national output was just lost, wiped out in just 23 low and middle income countries over a 10-year span, all because of NCDs. So you see, this isn't just a health crisis, it's a massive, massive roadblock to economic development. And what makes this loss so tragic is that it completely torpedoes something economists call the demographic dividend. So what's that? Well, imagine a country hits this perfect sweet spot, this golden opportunity, where it has a huge population of working-age people and relatively few dependents, kids and the elderly. It's like a once-in-a-generation chance for the economy to just explode with growth. But NCDs, they don't wait for retirement. They strike people right in their prime working years. And when that happens, that golden window just slams shut. The opportunity is gone. Okay, so that's the bad news. It's a huge problem. But how do we fight back? Well, let's pivot from the problem and talk about the solution. And it's a proven, incredibly powerful one: prevention. And if you want proof that prevention works, just look at Finland. This study is just incredible. From 1972 to 1992, they didn't just hand out pamphlets. Oh no, they launched this massive, all-hands-on-deck community effort. I'm talking about working with dairy farmers to lower fat in milk, getting bakeries to use less salt, the whole 9 yards. And the results? They were spectacular. Look at this. Cholesterol levels dropped, blood pressure went down. And the big one? In just 20 years, deaths from heart disease in one region dropped by a mind-blowing 85%. Now, I know what you're probably thinking. Okay, a story like Finland is great, but that must have cost a fortune. Well, here's the absolute best part. It's cheap. No, seriously, it's incredibly cheap. A full-on prevention package, tackling tobacco, alcohol, diet, all of it, costs as little as 1% to 2% of a country's entire health budget. Just look at this chart for India. See that tiny, tiny little sliver? That's the cost of prevention. It's practically a rounding error compared to what we spend treating these diseases after the fact. So if prevention is this effective and this affordable, why isn't everyone doing it? How do we actually make it happen? Well, the secret is to stop thinking that health only happens in a doctor's office or a hospital. And this table, this is the secret sauce right here. Experts call it a multisectoral approach, but let's be real, it's just teamwork. It's the idea that tackling something like smoking or bad diets isn't just a job for the health department. As you can see, the finance department can step in with taxes, the education department can build awareness, heck, even the people who plan our cities can design them to get us moving more. It's about everyone getting in the game. All right, let's look at some real-world examples, because this is where it gets exciting. First up, Uruguay. Their big target? Tobacco. And who led the charge? Not the health minister, the president of the country. He stepped up. And the result of their new smoke-free laws? A 91% drop in air nicotine in public spots. Now that's leadership. Next up, Samoa. They had a big problem with super unhealthy, high-fat, imported meat. So where did the solution come from? Not a diet campaign. It came from the Ministry of Revenue and the Customs Department. What did they do? They just banned the import. Simple as that. And poof, the supply of that unhealthy meat dropped by 98%. That's trade policy becoming health policy. And finally, let's go to Bogota, Colombia. The city wanted to get people moving more, so the Transport and Recreation departments teamed up and did something pretty radical. They shut down 70 miles of roads to cars every single Sunday. And now, more than 1 million people come out every week to walk, to bike, to just play in the streets. That's urban planning literally saving lives. Okay, so we've seen who can make a difference, but what tools can they actually use? Let's pop open the toolkit and take a look. All right, one of the coolest and honestly smartest tools in the box is something called a nudge. Now, the whole idea here isn't about forcing anyone to do anything. It's not about new rules or bans. Instead, you just subtly change the environment to make the healthy choice the easy choice. You make it the default, the path of least resistance. It's all about making it almost effortless to do the right thing. And here's a perfect real-world example of a nudge in action. Imagine an architect designing a new building. They create this beautiful, wide, inviting staircase right in the middle of the lobby. And then they make the elevators really slow and tuck them away in a corner. So what do people do? They take the stairs. Nobody told them to, but the design of the building just gently nudged them toward the healthier option. Now, besides these clever nudges, governments have 2 other really big levers they can pull. First, there's price. It's basic economics, right? You can use taxes to make unhealthy things like cigarettes more expensive, and on the flip side, you can use subsidies to make healthy things like fresh vegetables or a bus pass cheaper and more attractive. The second big lever is education. It's all about building public awareness, explaining why these changes are so important. Because when people get on board, it's way easier to pass new policies and make sure they actually stick around. When you boil it all down, it really comes back to this one powerful idea from the World Bank. Fighting this silent epidemic, it's not just a job for doctors and nurses. They say it's, and I'm quoting here, everyone's business and the whole of society's responsibility. And that really leaves us with one last thought to chew on. Take a look around your own town, your own community. Who could be the next totally unexpected public health hero? Is it the person designing the new park? Is it the local government official setting tax policy? Is it your kid's school board? The answer? Well, it just might surprise you.